Dan memutuskan untuk melaksanakan Perintah Kawalan Pergerakan mulai 18 Mac 2020 iaitu lusa.
Assalamualaikum and hi. Me and my groupmate are from Group 2 and we are going to discuss about the Movement Control Order Policy.
Assalamualaikum and hi. My name is Alia Shadli binti Razmi with number matrix 2021479168. The first policy problem is because the cluster from China started entering Malaysia. At January 2020, 3 clusters from China was found positive COVID-19 who has entered Malaysia from Singapore. The government had to impose restrictions on tourists or foreigners from entering Malaysia. However, Malaysia citizens who wish to return back to Malaysia need to do screening tests and quarantine for 14 days. This policy were implemented because the government want to prevent the virus from infection in Malaysia. The second policy problem is because of the increasing infection of students in school. Virus COVID-19 started to infect the students from day to day until there is clusters of students. SOP has been tightened for all students and teachers, which is wearing masks and keep distancing 1 meter from others are necessary. The government stressed the need to close the school that have high risk of infection to control the transmission. Meanwhile, the low-risk schools were allowed to operate which strictly follow the SOP. This action actually taken step by step because government cannot strictly close all education places because it will disrupting their lessons. This policy was applied until the transmission of COVID-19 is not under control. Next, the transmission of COVID-19 occurs through contacts. To decrease the transmission of virus, government has encouraged the people to use card or scan payment or online transfer using apps on every purchase if possible. Government also encourage people to reducing the use of cash because it want to avoid contact with people. Because people are touch the money and it always change owner when they are purchasing anything. Lastly, the policy problem is because of the increasing number of cases occurred to gatherings. Government started to announce the prohibits mass movement and all gatherings are not allowed. For example, Muslims are not allowed to have Friday prayer at mosque since there is people gathering, and wedding also are not allowed to operate. But food outlet, supermarkets, manufacturing, supplier and retailer that selling everyday necessities are allowed to operate since there is the need of people.
Movement control order that have been implemented have several objectives in the establishment of the movement control order to address the issues of COVID-19. The objectives are to prevent the COVID-19 virus from spreading widely. MCO have managed all the people's movement in Malaysia. Movement control order that were implemented for several weeks, all travel and movement of the people were restricted. Also, all of the gatherings are not allowed if it include large number of people. It's because if the movement of people were not restricted, the number of cases of COVID-19 will increase. It can be proven by the number of cases will slowly increase in March because of the religious gathering in Sri Petaling, Kuala Lumpur. Another objective of the MCO is also to slow the transmission chain of COVID-19 among the community. During MCO phase, all premises are not allowed to open for a while. But in the second and third phase of MCO, all premises like shopping mall and eatery are allowed to open but only from 8 AM until 8 PM. And it was controlled as the regulations of the MCO. The business of selling food like eatery owners only operate by way of drive-thru, takeaway and delivery. This is because the virus of COVID-19 would increase if all the premises like shopping mall and eatery would not be controlled because these places visited by many people. The objective MCO was implemented is to make sure the movement of the people is not free to slow the transmission chain of COVID-19 among the community. Last but not least, another objective of the Movement Control Order is to control ongoing public health concern caused by COVID-19 and also to prevent the outbreak from developing further by containing the infection. To do so, the MCO was enforced. The MCO enforced is to curb these problems of COVID-19 from developing in the future. During 4 phases of MCO, especially in the Recovery Movement Control Order phase, the government has made rules by prescribing the wearing of face masks when citizens want to go out and made it as a new norm. This is because the wearing of face masks have been made as a mandatory when leaving the house since before and until now, even though the cases will decrease slowly, and it's because to prevent the infections in the future. The use of face masks is indeed able to reduce the percentage of infections. With this, during MCO, the face mask has become necessary as it can reduce the issue of COVID-19 in the future from development.
Assalamualaikum and hello, my name is Anzulaika binti Hussein and my metric number is 2021650012. Coronavirus has spread around the world including our country Malaysia. There are many actors that involved and work together by participating the policy program and activity. First and foremost, Prime Minister, because he is in charge of the country power. When the first case was discovered at the airport, Prime Minister Muhyiddin Yassin declared that all the border in the country will be closed. As a result, all international visitors and Malaysian citizens are forbidden from leaving and entering the country. It is to prevent the virus from spreading further because the airport is the where the virus started. Next, sector that involved is health sector. Health sector can be divided to two, which is public and private. People were affected of the virus are brought to the government hospital, but because of the many people, the hospital did not enough supplies such as bed, oxygen, nurse, personal protective equipment, PPE and others. As a result, a private hospital offered assistance to the government hospital. Doctor and nurses of the frontliner become very ambitious to keep everyone safe. Even it means they need to working overtime, getting affected of the virus and so on. The Ministry of Health (MOH) published guidelines or standard operating procedure to inform people to aware about their health. Last but not least, the police and military worked together to guarantee that the movement control order MCO was properly implemented. They ensured the people to stay at home because the order command the people not to go outside except emergency. They also monitor the movement restriction, particularly in red zone. This is because since many people are stubborn and seek to internet, they need to constantly watch it. Police also set up the roadblock in every state and district so that people only can travel inside a 10km radius. As a result, the police and military cooperation can be prevented because some people cannot get together because the government MCO policy. Finally, academic and tactician. They assist the government by providing statistics and advice to help the problem. Also, academic from the University Putra Malaysia UPM do research and help the government by producing more than 100 of instant hand sanitizer using their skill and knowledge. It helped a lot because many people need hand sanitizer, but many places are out of stock. Conclusion, even do come from the different sector of actors fight together to achieve the goal and ensure the everything runs smoothly and well.
The first implementation for this policy is government implement the restricting of mass movement, which is people are not allowed to gather mass in public places, gathering across the country, including religious places, sports, and many more. People who returning to Malaysia need to do quarantine for 14 days and need to isolate if they are positive COVID-19. These actions are helping government to identify and trace the transmission of COVID-19 to people. With that, they can figure out the best way to stop the transmission from growing. Next implementation is the prohibited from leaving and entering Malaysia, because government need to make sure there is no new cluster COVID-19 and to avoid transmission from outside the country. Datuk Seri Ismail Sabri have said that all Malaysians who returning to Malaysia are subjected to do quarantine for 14 days to detect the symptoms and the test result, which is negative or positive. This policy are to make sure that Malaysia stays in control of transmission of COVID-19. Government also do the restricted from only 2 people in a group are allowed to go out for certain reason at one time. For example, 2 representatives in one group allowed to go out to the supermarkets, going to work with same car or across the country for a certain business. This policy are trying to reduce the number of people at public and thus there is less risk for people from infection of COVID-19. Last but not least, government gives permission for certain business or premises to run their operation during MCO. For example, supermarkets, grocery stores, manufacturing, convenience store that's selling everyday necessities and essential services. It may create difficulties in our daily life. However, this action is a must to curb the spread of COVID-19. At the same time, it also to cover the economy of Malaysia from losses.
Assalamualaikum and hi, my name is Noizatul Alia binti Mazan with matrix number 2021831902. I will tell the evaluation of the effectiveness of the policy. First, this policy has helped to reduce COVID-19 cases that occur in Malaysia and can reduce and prevent many people from being affected with COVID-19 disease. As we know, the pandemic that happened to the world has caused the increase of death toll, and it shows how dangerous the virus is. Some people have lost their family, loved ones, or friends during the pandemic. Even though people should face the social distance for a long time, but it helped enough for people to not be affected by the COVID-19. From what we saw, it has changed the way people live. The Movement Control Order or MCO has reduced people's worry related to COVID-19 disease. This is because pandemics that occur throughout the country can be prevented through the implementation of this policy. Then, MCO has helped people to take care of their health and be more careful about cleaning, such as sanitize your hand and wear the mask when going outside. It makes people be more aware with COVID-19 and cleanliness. Hand sanitizer have been the most important thing nowadays to have when going outside or have shake somebody's hand to prevent from the virus. They have been more careful than before and make them more aware with the safety and health of their family. Even though MCO policy has its own weakness, it helped for the COVID-19 disappear with fast and people go back to normal to go to work or to school. Although it shows how effective this policy are, but there are disadvantages in this policy too. As a Malaysian, we can see how people are not freedom in doing anything. The government has restricted everyone's freedom to do things. For example, restricting them from running a business and making it difficult to get out of the house via the reasons. This has an impact on some people as it is difficult to earn a living during the implementations of this policy. Some businesses have been forced to close due to bankrupt and lose due to the closure of the business over a long period of time. The number of people working into the supermarket is also limited and have to queue to enter the market. Many people have been impacted by the pandemic as well as the policy. Many workers have lost their job over what happened and make it difficult for them to find financial resources. This has caused the percentage of Malaysians with mental health problems to increase. So, for the new recommendation for this policy is the relevant authorities must keep a careful eye on the planning, and adherence to the movement control guidelines and SOPs, particularly in reopened sectors and areas. The authorities should monitor and control every place so that everyone follows the prescribed law, including wearing masks and social distance. If no monitoring is done, it is likely that there are many who break the rules, resulting in COVID cases increasing again. Among the places that must be monitored by the authorities are markets, restaurants, and shopping malls. The people need to learn from what happened, then they need to follow the rules set for the safety of the country and themselves. The government also needs to take a lot of action in observing the SOPs implemented in each state. Employees such as restaurant workers also need to be trained in this new norm of how to manage their business by the following SOPs, such as there are temperature scanners, hand sanitizers, and seats that have social distancing. This could help to strengthen public health and health protections. Next recommendation is increase the level of technology. As we know, many people are difficult in using technology. Since to the MCO, they can interact with other people in face-to-face. Some students also can't join the online class since they have slow internet. It makes them feel discouraged to learn and give up to follow the learning sessions. So in upgrading the technology in Malaysia, it could help many people use the internet network easily. Speeding up the internet network can help students to learn easily and easily to them to enter each class. Furthermore, the other recommendation for improved Mco policy is increased research into prevention and preparedness. The government should well prepare their plan for the next 5 years. This long-term plan will help the country to prepare what will happen in the future. The reason for this is to ensure studies and happy done for prevention can guarantee help in the future. If the COVID pandemic happens again, the government can take action by following the plans that have been made. This is to prevent the country from becoming chaotic and unprepared in this situation. Azrul Muhammad Khalid, head of the Khalid Center of Health and Social Policy, emphasized that the public healthcare system, including healthcare resources, should be ready to accommodate a future surge of COVID-19 cases as the country's borders reopen.
Therefore, all that has been discussed is related to the implementation of the Movement Control Order. In conclusion, MCO has given many impact to all people regardless of religion and race.
It's not about me, it's about what we can do together as one for the COVID.